Therapy is a big part of supporting one's mental health journey, but many people feel like they're on a therapy merry-go-round, hopping off after just one spin. If this is your experience, you're not alone. Today's guest will help us understand the art of the patient-therapist duo and get the most out of your therapy. Colleen Marshall is a senior leader in behavioral health and the vice president of clinical care at Two Chairs. Welcome, Colleen.
Hi, welcome. Thank you for having me.
Yeah, happy to have you on. So, Colleen, a lot of people, they're focusing on their mental health right now. It's the beginning of the new year. We want to set those goals in plan. Why does having a good connection with your therapist make such a big difference in how well therapy can work?
Yeah, so therapy is a relationship-based intervention. So what that means is the relationship has to be right for therapy to work. And so when we're talking about what do we mean by a good therapy relationship, what the American Psychological Association says is it should be a relationship where the client and the therapist both are working on mutually established goals,
Hmm.
and that the client feels like they are able to give back to the therapist, and the therapist is adjusting care based on that feedback.
Hmm.
So this overall relationship and intending the relationship is super important for clients to actually see positive outcomes in treatment.
Yeah, especially to these really important personal conversations that you're having. You want to make sure you have that good relationship with them, like you mentioned. What are some common reasons people give up on therapy after just a session or two?
Yeah, unfortunately, many people actually only go to one session and then just decide therapy is not for them. And most of the time, that's because they didn't find the right person, they didn't find the right relationship. And 1 out of 5 will say they left because they didn't trust their therapist. So we know that relationship and getting the right relationship is important, because what's unfortunate about that is 50% of people seeking treatment actually need to be in care for at least 15 sessions to 20 sessions to reap the benefits of therapy. That's why at Two Chairs we created the matchmaker system. Is we knew that we needed to get the relationship right from the very first meeting, so that clients are matched to the right person, but also so that they stay in care so they can see positive outcomes from treatment.
And how can this also help take away the stigma of getting help?
Yeah, so really thinking about mental health as health, all of us have different things that we're working on in our lives, and mental health should be thought of and talked about in the same way, that we just need to find the right relationship and the right therapist to help us with some of our mental health goals. And thinking about it the same way we would if someone had diabetes, we wouldn't judge them for seeing a nutritionist to help them figure out their blood sugars.
Hmm.
The same is with mental health. If someone has depression or anxiety, for instance, seeing a therapist to help you with that chemical imbalance can help you feel better. And so we really should be thinking about that as just health in general.
Yeah, and I mean, for therapy, for some people talking about mental health, it's something completely new. Maybe for some people, it's not something that they regularly did growing up. But how important is it to check in on your mental health regularly?
Yeah, it's as important as getting a physical. What Two Chairs, when we talk about mental health check-ins, we mean using data, filling out standardized assessments like for depression and anxiety to really see how you're doing. And we use those check-ins every session with clients so that clients can see if they're getting better or staying the same or getting worse.
Hmm.
And their therapist also can track the client's progress in their own the therapist platform, because knowing using data to know how you're doing and using some of these standardized measures will help us know whether or not we are maybe suffering from depression and or anxiety, and that maybe therapy is indicated.
Yeah, and it sounds like it's able to personalize your experience. Can you expand a little bit on the idea behind Two Chairs and that matchmaker feature?
Yeah, so Two Chairs is a mental health organization. So we're helping people with their mental health and creating access for all to exceptional mental health care. And the matchmaker system is what we started with was really making sure we got the relationship right from the beginning. The way the matchmaker works is the client start off meeting with a licensed therapist, who screens them not only for what their goals and treatment are, but also what are their preferences in a provider. Things like, do you want an expressive therapist? Do you want a directive therapist? Do you want someone who works on homework? And you want someone who doesn't use homework? Things like that. And then the therapist takes all that information and puts it in our algorithm, and the client gets matched to a therapist based on 300 different factors. And we know it's working because our data tells us so. Excuse me. So 98% of clients, we're matching them right on the first time. 2% of the time we do rematch people if we don't get it right. And what we're seeing is our clients are staying in treatment much longer than the national standard. Because right now, in the national standard, only 33% of people in care are staying towards their fourth session, where
Wow.
at Two Chairs, 90% of our clients are staying for that fourth session.
Wow, that's amazing. Well, I'm going to let our viewers know where they can learn more information about it. You can find out more by going to twochairs.com.